Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. 12 minutes past 8 o'clock. It is Thursday morning. It is July 24th, 2025. Good morning, everyone. I'm Scott Michlin, and thanks for tuning in to KSJE 90.9 FM over the air here in San Juan County, New Mexico. In Durango, Colorado, we're at 103.3 FM. Pardon me, and everywhere else on earth we are streaming all the time from ksje.com, or maybe you're listening to my voice through the new KSJE app. Welcome aboard. Glad that you are joining us this morning. Also to welcome our viewers who are watching the video of this program streaming out live to the KSJE Facebook page and also to our YouTube channel. So we're glad that all of you are with us this morning on all of our different platforms, because coming up today we're going to get an update from our friends at the San Juan County Partnership. Of course, as usual, lots of things going on with the San Juan County Partnership and the work that they do in the community. So stay tuned for an update coming up in the next few moments right here on KSJE today. Then, of course, next hour, Mick Hess is going to take us roving with the arts. That's our weekday classical music program. That starts a little less than an hour from now on KSJE. If you're a podcast listener, we want to remind you can connect with us on Instagram and Blue Sky and X and download podcasts at places where you're already listening to podcasts. So check it out and maybe discover a new local program that you may have missed. Podcasts are also a part of the KSJE app. So if you have the app, you've got the podcast right there in your pocket. You can find the app at the App Store or Google Play and add it to your app collection. Outside our studios at San Juan College, it's a partly sunny Thursday morning, 70 degrees at the moment. We're expecting a partly sunny day today. The high reaching 86 in Farmington. Clear skies tonight, the low 64. It'll be sunny tomorrow with a high of 89 on Friday and again on Saturday with overnight lows in the lower 60s. Warming up this weekend and 91 Saturday and Sunday with overnight lows near 70 degrees. 87 with partly sunny skies then next Tuesday. And maybe, I don't even want to say it because it's Connie Mack week, but maybe a little bit of RAIN in the forecast beginning Tuesday night. We'll have to see what happens. Back with my guest from the San Juan County Partnership right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care. Always great to have you here. Amanda Evans is here in the studio with me this morning. Good morning. Welcome back to KSJE.
Good morning. It's great to be here.
Good to have you here to talk a bit about, again, some of the work that you and the partnership does in the community. And we've talked about this topic before, but it's important, I think, always to kind of talk a little bit, remind folks about it, and that is the opioid epidemic in San Juan County and the state and the nation, for that matter, and the work that you are all doing. You have a lot of resources and some grant money that is helping to educate the community about what's available and what's going on, right?
Yeah, we've had a grant for the last 5 years that has helped us really push Narcan into the community and make it more widely, not just available, but understood, because I think there's been misconceptions over the years. And so we're trying to make sure people understand what it is and what it can do and why to have it on hand.
Right. And again, Narcan is one of the names for the drug that is used to treat possible opioid overdoses, correct?
Yeah, so Narcan is the brand name. Naloxone is actually the name of the drug itself. So we kind of use them interchangeably because for so long Narcan was the only one available, and now
Right.
we have generics and things that do go by naloxone. So yeah, we have this amazing drug that can help save lives if you have an accidental overdose, or even for whatever reason you might have too much opioids in your system and you need help with that, and naloxone is one of the drugs that could do that.
Right. And it's really amazing. I know you've talked to me before about that too, because if someone is not having an opioid overdose, but you think they are, and you're not a medical professional, but you just want to get them help, and so you administer this Narcan or naloxone, it doesn't do any harm if it's not what's happening. And so you could save them and help them and save their lives, literally, or if it's something else unrelated, it's not going to do any worse, I guess, damage to whatever else is happening, right?
No, there's really no downside to using it. If there's someone that's down and you suspect they might be dealing with an opioid overdose, especially now with fentanyl so widely available, it's really, if you give it to them and there's nothing, they're having a different issue, it's not going to have any damaging effects. Once the EMS or someone gets there and can assess, and they might need different, it's not going to impact what EMS needs to do,
Sure.
or anything like that. So there's really no downside.
Right, and that's why I think it's been so widely touted and such an amazing addition to EMS and other medical professionals' response to folks who are having a difficulty, because we don't necessarily know what's going on. If they can't tell the responders, you kind of got to figure it out on your own.
Right, and that's what's great is, it's something that you can keep in your medicine cabinet, and you don't have to worry about, if someone gets a hold of it or uses it, or you use it on someone you might suspect of having an overdose, it's not going to hurt them at all. So
Right.
it's really a life-saving tool that there's no downside to.
Yeah, exactly. And so as you do the partnership, and we love that you do that, you've pulled data about
Yes.
some of these things, and the work that you've been doing over the last few years, and shared it with us this morning, and we've got part of it up on the screen right now to kind of talk a bit about where things stand and how things have moved since you've been kind of really focusing on this problem.
Right, and so we've seen a dramatic increase in overdose deaths here in San Juan County. I think that's across the country as well, but these are local data specific to our area. And so as you can see, in 2023, there were 49 deaths due to drug overdose. Over half of those were involved in opioid. 26 of those involved fentanyl, which we know is quite deadly. And then it's also talking about 27% of San Juan County residents have a close family member or friend who frequently uses opioid pain medication. And almost half of those believe their friend or family member could be at risk of an overdose.
Wow, and that's local numbers. That's
Yes.
San Juan County data, right?
Yep.
And so how does that compare? I'm going to put you on the spot again, and I don't know if you know the answer to this. How does it compare to the rest of the state? Do we know? Are we about average? Are we right in the ballpark, I guess, of this problem statewide?
That is not something I looked up for this morning.
I'm
You caught me
sorry.
off
I
guard.
put you
I'm
on the
sorry.
spot.
I
That's-
should have been more prepared.
No, you shouldn't. No, that's all right.
No, I don't know how we compare currently with overall with the state. I do know we're usually, from the data I have looked at over the last few years, we're kind of upper half. We're not one of the top five. There's several other counties that are dealing with this on a wider scale
Sure, okay.
than we are, but we're definitely up there,
Yeah.
upper half. And so it's something we definitely need to be concerned about. I think part of this is talking about it's steadily increased over the past decade, and
Right.
we've seen it doubling since 2018. So that's where we start getting concerned, is when we see these huge jumps in numbers, so that it's not just a small problem, we're seeing a big increase in it.
Right, I got that. And again, this also talks about kind of the work that the partnership has been doing over the last, 4 years, to try to educate the community about the problem, like
Yes.
being on the show and me asking you questions and things like that. And then also some of the trainings about it, and also some of the Narcan trainings too that I think you've gone out and been doing throughout the community too.
Yeah, we've been doing pretty consistently. We've done quite a few organizations, so their staff is trained on Narcan use, which is, something that's really important. If you have somewhere where the public goes a lot, you can have an issue that might come up, and
Right.
it's something that can help save a life if it happens. And so we've trained many organizations. We've trained just community members. We've been able to take Narcan out at events like the recovery event that happens in the fall with San Juan Safe Communities, and pass out Narcan there and do some education. And so we've just seen a huge increase in the understanding of it and the availability.
Right. Right. And because of that, it looks like that we've seen some of these results in the community as well, because of the work that the partnership and other groups are doing, right, to get the word out about Narcan or naloxone, and that it's available, and how to get it and where to get it. And you've made it available, I think, too, for folks who want to get it, all these different things. And so more data to share that shows a little bit about that word that's getting out, too, that seems to be heading at least in the positive direction.
Yeah, so this one of these charts is showing that 42% of survey respondents, and this is the New Mexico Community Survey, so this is all local people who take our survey each year. And so in 2022, we had about 20% who used opioid pain medication and also had Narcan available, and we're up to 42%. So almost half of people who are reporting for this specific survey that they
Sure.
use opioids and have Narcan available.
Which is great, right, in case of a problem or what
Yes.
have you. And so that's really important. Or again, kind of know how to get it. And then the second data point there is showing more than half of San Juan County residents are saying they know how to get this or where to get it if they need it.
Yeah, and that's what's been great is not just the work we're doing, but there's several other organizations in the community that are really helping to get it out there. We're able to hand out Narcan for free, which is has been a kind of problem in the past with people who, there's a law where if you're prescribed opioids over 5 days, a doctor has to also give you a Narcan prescription. But when you take that to the pharmacy, depending on your insurance, there might be a copay that's prohibitive to you getting it. Your insurance might not cover it at all, and then there's quite a cost for it. So we've got multiple places now here in the community that give it out for free. We also, it's available even in stores now. I think I saw it in Target recently, and because it's become an over-the-counter medicine. You can get it at any of the pharmacies, and so it's really just more widely spread and easy to access.
Right, which is great. Again, part of that messaging and educating the community. And then again, that final data point there shows us in the last, 2 years or so, you have trained almost 400 people in how to administer Narcan or all about it or how to use it and things like that, too, which is another important step.
Yeah, we do a whole training. We can do two types. So if you just come in for Narcan, we can do a shortened training that's how to use it, how to store it, kind of how to keep it properly. But we can do a longer one with these organizations we're working with. We have like a full hour to 2 hour presentation on not just how to utilize it, but what are the signs to look for in an overdose, how to tell if it's an opioid overdose versus something else going on. And so those are really important for our organizations, like I said, to deal with the public, to understand in case something happens in their place of business.
Right, almost like a train the trainer kind of a thing, right?
Yes.
To then to kind of keep it multiplying, I guess, for people to go and then train their folks or more of their peers.
Yeah, we've actually had a couple train the trainers where we actually we train people to do what I do, which is actually give the presentation and be able to train their staff. So we have several organizations, we had several law enforcement go through that so they can train other people in their organization or outside of their organization and get people more aware of what's going on with it.
Which is great. And so these numbers are heading in the right direction, as we said. And so as you look towards the future, I guess, what does that mean for the partnership? I mean, stay the course, trying to do more, reaching out for more, maybe grant funding to help you do what you're doing with these types of numbers?
We do. So the grant we've had for the last 5 years is ending, but we already have funding through the state. That was a kind of federal funding that we had, and we're going to have some state funding through a program, and we're going to be able to do still quarterly Narcan trainings, still hand out naloxone, still kind of do a lot of the stuff we were doing. So it's just going to continue on through different funding sources.
Nice. Very good. And for the community and for groups that I guess maybe are listening and watching this morning, we've got your website there and other information, the email address if folks want to sign up or reach out and say, hey, how can we schedule a training or at least get some information for our members? What can we do?
Yeah, that's great. You can always send us an email. You can go on our website, and it has all of our phone numbers, so you can find me directly and give me a call, and we can set up something that works. I can come to your organization. We can bring a few of your people into kind of a community training. We can do it on lots of different ways. We really want to make it fit for what the community needs.
Right. Right. Very good. And so, again, moving forward, to get more information now, you talked a little bit about some of these other events that happen maybe in the fall, and that's going to maybe happen again?
Yeah. So recovery event with San Juan Safe Communities happens. They've been working with doing it the same time as National Night Out with Farmington Police.
That's right.
And they're kind of doing a big redo this year. So they're still going to have National Night Out, but it's going to be called a little different, and it'll be held downtown, and it'll be just a little bit bigger event for the community. And so we're always out there. We'll be out at the fair. I don't think we're going to have Narcan at the fair, but you can definitely come talk to our booth, and we can set up a time when you can come to the office or set up a training or something like that.
Right. Very good. And it's really been amazing just how much that drug has made an impact for the area and for the state and nation too, again, with all these unfortunate overdose deaths and issues, even though those drugs are very powerful and can really be helpful if used correctly and carefully. But if not, this is what happens sometimes, and we see that.
Yeah, and we're not saying that all opioids are bad.
Sure,
I think that's a
right.
misconception when we talk about some of this topic is there are legitimate pain reasons. You and your doctor need to make that decision, and we never want to tell people, like, don't use opiates. If you and your doctor have come to that agreement and that's what works for you, but just know the risk of it, that there is a potential for overdose even if you're being careful with it. And so we want to make sure people have access to something in case that happens, or in case someone else gets into it, a pet gets into it. Narcan can actually save an animal is what I've been told. I have not tried that myself, but,
okay. But yeah.
Or, your kid or grandchild or whoever gets into the medication, that we aren't just talking about someone who is utilizing opioids illegally, but also even if you have a legal, responsible use, there's always a chance.
Right, and that's an important thing too. And certainly there are other programs that you and I have talked about of how to store drugs safely
Yes.
in your home and elsewhere. But beside the point, if you were to have an incident or someone not in your household or even in your household got into that and had a problem, then Narcan would help that. So that's an important thing as well to talk about. What else is going on? What else do you want to share this morning about the San Juan County Partnership?
Well, on that topic, we actually will have locking bags out at the fair for free.
Nice.
We do have a limited supply, so come see us early in the week.
Okay.
Because last year I think we ran out about midway through the week, so we only have a limited supply each year. But we will have those give out for free. They're an easy way to store your meds. You can put in a combination on them and then store them out of reach of kids. So I definitely want to, let people know they can come see us for that. We also have programs going on around media campaigns. So you might see some of our stuff out there about stigma and what that means. Because what I was just talking about is people have these kind of preconceived notions about someone who uses substances either legally or illegally and what that means. And so we really want to kind of combat some of that and make sure people understand that people are people first. And if maybe they do have a substance use disorder or something they're dealing with where they might be taking too much of something or the wrong amount, the wrong types or things, they're still deserving of help and they still are a person first. And so we have trainings about that where we can come into your business and talk about what is person first language, how can it make a difference on maybe someone getting treatment versus not getting treatment.
Right. And so do you find sometimes that if someone is making that important step to reach out and try to find help, and then they go to get help, and then something happens during that first encounter maybe, and then like, oh, well, maybe it's a waste of time, or maybe I shouldn't bother, or maybe I should just go back home or whatever. Is that kind of what happens in some instances?
That is what we hear. We've done some surveys around that, and we see that, a person who is asking for help, that's always a hard thing to do anyway.
Big step.
And so if you are going into maybe your doctor's office, or you're going to a friend or someone to ask, like, hey, help me, and then they respond really negatively, like, just do it yourself, or if they use words that aren't maybe, that are kind of stigmatizing, we're really trying to get away from things like saying a person is an addict, because there's more to that person than just their addiction. So we try to use words like that they have a substance use disorder versus an addiction, and things like, a lot of times we talk about drug testing. In the past we've said clean and dirty test, and we want to get away from that. So we want to make these language changes so that someone understands that what they're dealing with is an issue, but it's not their whole person.
Right. Got you. And I guess there's some data to back that up too, that shows that can be effective for these individuals that are taking that big step to reach out for help, and they'll continue, I guess, maybe their efforts, because it really has to have buy-in from the person. They can't just ask the doctor to give them a pill to fix whatever it is they're trying to get fixed.
Right, and so we actually have a stigma guidebook that we're going to have also out at the fair and any of our community events, or if you just want one, you can reach out to us and we can get it. And so it goes through some of those data points. I think it's around 40% of people who I'm off the top of my head, I'm trying to remember how the wording of it is.
Again.
I know.
Right?
I need to come more prepared to your shows. You've
That's
always got
okay.
good questions. But so people who are stigmatized are much less likely to get help.
I got it. Right.
But we
Sure.
do have like the actual facts in our guidebook. It's
course.
just, I didn't read it this morning.
That's
and
okay.
I
Well,
slept.
there's a lot of things going on. We've been talking about that too. But that is really important, I guess, for folks to understand. And so for these workers in these offices and things like that, for them that may have never thought about the words that they use or the language that they use, this is probably maybe a little bit eye-opening for them. And they're maybe just doing this and then unintentionally. They didn't mean to use these words that are maybe turning these potential patients off, but it's good to be aware of it, I guess.
Right. And I mean, it's just the culture of our language. There's changes that happen over the years, and we do better when we know better. And so I remembered when I started in prevention a long time ago. We won't talk about how long.
You're a child.
I wish. So, I was working down in Las Cruces at the Border Health Office, and we started this and we called it a substance abuse committee.
Right.
And now that's a language we don't use anymore. We use substance misuse or substance use, but we don't say abuse just because it can be stigmatizing. And so that's just, people get into habits, and that's what's known to use those words. And so it's not the bad person for not knowing the new language kind of thing. And that's what we just want to do, this education and these presentations and some media even about educating organizations who might be dealing with these problems, and also just community when you're dealing, maybe you have a family member that's going through it, and what can you say to maybe encourage them to get treatment versus discourage them from that, asking for help.
Right, very true. And again, as a broadcaster and a journalist and a teacher, I'm always amazed by the vocabulary and the words that we choose to use, and trying to use the right word in the right spot for the right message. And this is all part of that as well. And so that your message as a communicator is not misunderstood, and that's the idea, I think, behind some of this conversation about choosing the right word that doesn't have a stigma, that doesn't get the results that you want, because ideally you want that individual to get the help that they need and not be discouraged and not be turned away. And you may not have meant to do that, but that's what happened.
Right, and that can, there's multiple, we talk about substance use, and that's kind of what I'm focused on today, but
Sure.
This can be even mental health issues. We have stigmatizing language around that, and the Health Council is going to be working on some of that this year. And so it's really, to me, I don't know who coined the term, but we talk about people first language. And to me, that's where it really hits, is if you treat people like they're people dealing with a problem instead of a problem that a person is attached to.
Right.
It really makes a difference on how they see themselves, how you see them, and it can just makes the community a better place if we're treating people like people.
Yeah, very true. And I think all too often these days we kind of feel like we're a number or just a thing or a whatever. And so to get that is probably refreshing to a lot of folks when that does happen, and probably could be happening in other industries too, not just the substance abuse areas or mental health areas or things along that line. So I think a lot of companies could probably benefit from a people first ideology.
Yes. Yeah.
So there's that. You may be onto something, Amanda Evans. We'll see.
Exactly.
Right. There you go. Well, we were just about out of time, but anything else to talk about? You'll be at the fair, the
Yes.
partnership. So
Come visit our booth. We've got lots and lots of resources, and we would be happy to talk to you and get you whatever we can help you with.
okay, very, very good. And once again, we'll call up the website and email address on the screen at the bottom there, the sjpartnership.org or office@sjcpartnership.org. Are great ways to reach out and get more information about all the things that the partnership does. And we're so grateful that they do. And that you're here every month to give us an update. So thank you for coming, and not necessarily you, but somebody from the office.
Yeah, I try to send other people so you're not seeing my face every month.
That's okay.
Yeah, and get a little, because we do a lot of work, and so this is just one piece of it.
Very true. Very true. Amanda Evans, thanks for being here.
Thank you.
Enjoy the fair.
Thanks.
You bet. We'll see you next month. That's Amanda Evans from the San Juan County Partnership, my guest this morning with me here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.